Hey everyone, Eric Christensen, pharmacist here from meded101.com. Just giving you the updates on the Ambulatory Care exam, BCACP, in 2025. Talk about preparation a little bit, also talk about content outline, how that's changing, and of course study materials as well. I always like to start with sharing the pass rates from previous exams. So this will be the same content outline that you'll have through October 1st of 2025. So if you take your exam, your ambulatory care exam prior to October 1st, you're going to have similar content outline, similar exam to what's been reported here in the previous pass rates. Unfortunately, at the time of making this in early 2025, BPS tends to be a little bit slow in releasing their results, but we do have March and April data from 2024. So BCACP exam, 67% pass rate. That's for all candidates. For first-time candidates is actually higher. So obviously in that percentage of all candidates, there's people that have failed it multiple times. So anywhere in that 67 to 75% range, I would say that's historically on par with where it's landed in the past. Typically with the BCPS exam and the geriatric exam, usually we're down into the 60s consistently, maybe even dropping below 60% at times as well. So ambulatory care tends to be one of the, I would say, easier exams for lack of a better term. So about the exam specifically, okay, this is an important thing to know. And I'm going to give you my take on this. So the content outline changes on October 1st, 2025. My preference would be to take it under the old content outline. So that would be earlier in 2025. If you're watching this video and thinking about this, potentially thinking about becoming board certified in ambulatory care, I would want my study materials and things that I use, based upon the content outline that's been seen in the previous year's exams. Okay. And I know that the pass rate is somewhat decent for those that, took the exam at least in that March-April timeframe in 2024. So my preference would be to take it, under the old content outline. Could the new content outline, the new exam, starting in October 1st, 2025 and beyond, could that be easier? Yes, it is possible. But I would say historically, from tracking this for 10 years, historically when there's a content outline change, the next year's candidates or the next batch of candidates, kind of being the guinea pigs on that new content outline, new exam, tend to do a little bit worse. Okay, that's typically the trend. Might not happen for this, but that's my take on that. About the exam specifically, it's 150 questions. That's fallen. It used to be 200, then it was 175. Now it's 150. Majority of questions, multiple choice, one answer, 4 possible choices. Obviously, we've designed our study materials like that as well. Only generic names. So that's a question I've been asked. Do I need to know all the brand names for these medications? And the generic name is what you're going to want to memorize and take note of there. And then go through those content outlines. In our study materials, we've done that. We've done that work for you and tried to obviously put in, everything that you need to know that's pertinent. But it's not a bad idea for you to go through line by line on that content outline, just to kind of get an assessment, get a feel for some of the things that may be quizzed upon or asked about on the BCACP exam. Timing, it's about 90 seconds per question. So I definitely emphasize doing some practice questions. Very, very important to make sure that you're not taking too much time, because if you don't get to a question, you do get penalized. So if you only answer 125, 130 questions, you're getting those final 20, 25 wrong. Okay? Really, really important that you're able to comfortably finish the exam. And so I typically recommend target about max 60 seconds per question. Gives you plenty of buffer, plenty of comfort level with your pace there, and some time to go back through, look at your exam and make sure you're comfortable with everything. So breaking down that content outline, again, this is going to be in earlier 2025, prior to that October 1st date. Patient-centered ambulatory care. This is 75% of the exam, approximately 113 questions. I always recommend focusing on your weaknesses. If you spend all day, in a respiratory care clinic in your work, asthma, COPD, you probably know that stuff pretty well. You're probably going to do well on that section. But if you don't touch, psychiatric conditions like depression or schizophrenia, for example, that's where I would kind of tailor my study plan to focus on that. So 2 simple concepts that I recommend paying attention to. Understand why you would select medication and why you wouldn't. Contraindications, potential contraindicated drug interactions, why you'd select a medication, it's guideline directed, maybe there's a compelling indication. Good example here, why you wouldn't select a medication. Think of bupropion. You probably wouldn't use that in a patient with seizure disorder. Why you would select it? Well, maybe they have depression and they're trying to quit smoking at the same time. Good example where we might use bupropion there. Be prepared to analyze case scenarios. Most of the case scenarios historically are kind of quicker. They're not, incredibly long, but you need to pick out various pieces of data within that, and that's going to guide you to select the best medication. So again, focusing on drug selection, contraindications, compelling indications, guidelines, adverse effects, major and unique, monitoring parameters, major drug interactions, genetic considerations as well. You think allopurinol, carbamazepine, bacavir, and HIV management. Those are kind of some, broad baseline things that when you're studying medications that you want to try to focus on and outline in your head. Don't focus heavily on dosing. So, for instance, knowing what the max dose of gabapentin is, or allopurinol, that's probably not a good way to focus your study efforts. However, things that are maybe a little bit more common knowledge, maybe a little bit higher risk, how to change a dose of insulin, anticoagulation, that's a good one. How would you adjust warfarin? Maybe knowing the dose of apixaban in atrial fibrillation versus, DVT, PE treatment management. Those are certain things that I would, recommend focusing on a little bit more because that's probably more so important in practice. And, obviously you need to have experience, pharmacy experience to be able to apply and take the ambulatory care exam. So you're going to probably recognize, that 800 milligrams 4 times a day of gabapentin. Okay, that's a, fairly moderate high dose for a patient compared to 100 milligrams of gabapentin. So you're probably going to recognize if, something seems like it's a really, really high dose or not, kind of for your garden variety type medications. But, some of those higher risk medications like insulins, anticoagulants, you may want to commit some of the dosing strategies and, minimums and maximum recommendeds in those situations. So keep in mind, within this section, patient-centered ambulatory care, of the content outline, it's not just drugs. There are other things listed: communication, prevention, educational barriers, health literacy, interviewing techniques, things like that. That's all within that area of the content outline. So again, in our study materials, we've tried to put all that in there in obviously much greater detail, doing the legwork for you of making sure that stuff is included within the things that you're studying and preparing for. I would say some of that stuff, interviewing techniques, educational barriers, health literacy, communication strategies, motivational interviewing, for example. These are some of the things that people are, I think, caught off guard by a little bit in their exam, at least in getting some feedback from folks over the years, decade or so of preparing content for this exam. And then we've got translation of evidence into ambulatory care practice. So this is your population health, your review of literature, statistics, study design, and pharmacoeconomic principles. Again, do not overlook this area. We've got a specific study guide that's based on some of this statistics content, as well as some of the kind of regulatory, population health, ambulatory care strategies, and that sort of thing as well. And then this is also included in the regulatory section of our study guide. This is 10% of the exam. Again, definitely significant when you start talking about 10% of the exam. 15 questions, that's significant. So a lot of terminology surrounding, MTM and CMM and things like that. Business models for ambulatory care practice, quality improvement, educational strategies, transition of care, care coordination. So these are all things that are within that section of the content outline that are probably a little bit more challenging for candidates to prepare for, I would say. Hopefully our study materials, our practice questions allow you to help better prepare for those types of questions. But again, don't overlook this section. Definitely go take a peek at it. If you're not using our study materials, you definitely need to look at it and understand, what's listed, what you need to look at, and what you need to prepare for. Really, really important. All right, our study materials content, we're up to over 20 hours. We update this content annually. I've just, within the last month or two here, updated about 20-25 videos to make sure that we're up to date with current guidelines and any new relevant medications coming out, things like that. Online question bank, we're typically consistently adding questions to that. I've also got a couple of practice exams within that question bank package, as well as with the full all-access package as well. That includes the videos and slide PDFs and things like that. And then those two specific study guides, the statistics study guide, ambulatory care, regulatory study guide, I think they're really, really important. That's going to be 25% of your exam. Those PDFs can definitely be helpful as well. And then we've got some various comparison tables for your studying needs as well. And then with the All Access Pass, again, that includes the review course as well as all the questions and everything. I've got 6-month or 1-year access available there. The question bank only options, these are shorter access, 1 month or 3 month. And then we've got, again, that online question bank is included. And then the 2 practice exams are included as well. Note that the regulatory, the statistics study guide, and the videos and the PDFs, comparison tables, those are not included in the question bank only option. Some of the testimonials I've received previously, your course is spot on. Obviously, I'd love to hear that. That's my goal, is to prepare you for this exam, gone through line by line on the content outline, trying to make sure that you're best prepared for this exam. And obviously, it's going to help you in practice as well, to learn or relearn some of these things that you may have forgotten since you went to school. So, again, you can take a look at some of these testimonials here if you want to pause the screen and take a look. Then here's a few more from previous as well. So, again, helped thousands of pharmacists, pass lots of different board certification exams. And again, we try to adapt based upon the content outline when and if it changes. And of course, the link to all our study materials, including the ambulatory care practice exam, you can find that at meta101.com/store. My email, if you got any questions, medaeducation101@gmail.com. Definitely get quite a few emails on these exams and can likely help you or at least send you in the right direction if you're questioning application process and that type of thing. So don't hesitate to reach out to me at mededucation101@gmail.com. Try to respond within a couple days there at least. So again, go check that out, meded101.com/store. Note, I will be providing an update probably in summer, early fall time frame. For those of you that are maybe looking to take the exam in 2025 after October 1st, again, my recommendation is to do it before if you're thinking about it in 2025. But if you're taking it after October 1st, 2025, I am going to provide a video with updates there. So hopefully that'll be helpful. I'll put that link to the study materials in the comments section of this YouTube video as well. And again, feel free to share this video with others that may be taking the ambulatory care exam in 2025. Thanks so much for listening. I hope this helps and wish you all the best on your preparations for the ambulatory care exam.